Are patients going into hospital at weekends more likely to die within a certain time than those admitted on weekdays? It's turned into a highly controversial debate as the government calls for better NHS services in England on Saturdays and Sundays.
We are absolutely determined to eliminate the weekend effect, which sees 11,000 excess deaths every year.
It's become a key issue in the junior doctors' dispute. Ministers argue that more staff are needed at weekends to cut excess deaths. The junior doctors say they already work on Saturdays and Sundays and challenge the idea of a weekend effect.
That's the part of the brain that's been...
Now one medical expert has questioned the data behind the excess deaths estimate.
We certainly found no evidence when we put together all the high-quality studies. It really is an excellent example of how poor quality data, badly interpreted, can lead to the wrong answer.
The study looked at data from one area used in death rate analysis and found that of nearly 1,700 reported hospital stroke admissions, more than 600 were actually for more routine problems, which were mostly on weekdays and with a lower risk of death, leading to a false impression that weekday admissions were safer. Research published last year which pointed to a higher risk of dying for patients who went into hospital at weekends has been quoted by ministers. Today, one of the authors defended the findings and took issue with the new study.
It would be great if this was the solution and we'd got it wrong, but actually, sadly, that isn't the case. There is still a problem. This doesn't undermine the study that we conducted, and there is still a major problem in the NHS at the weekend.
This latest row of NHS weekend services and death rates comes at a sensitive time in the junior doctor dispute. Today, for the first time in 3 months, the British Medical Association and the government sat down for talks with a timetable of just 5 days to try to resolve their differences. Whatever the outcome of the talks, the debate over weekend patient care is far from over. The government insisting there is evidence that standards are lower than during the week, while critics continue to scrutinise and challenge that evidence. Hugh Pym, BBC News.